Thank you for having me here. I did not know it at the time when we got out of Congress at House a week prior to the Senate, 31 July at 4 p.m. The next morning we had already scheduled a summit with about 400 individuals having signed up. And it was the very first town hall in all of this, the nation that had to do with health care. Since that time, and before I go back to Congress, I will have done 10 of these. I started in my district, I'll end in my district. I think it's the 4th of September in Upper Darby. We'll be having another one right there. But I've also gone about in the various segments of the communities. For example, we are doing one on women's health this Sunday at Bryn Mawr. We went to Mother Bethel Church, I went to, the oldest AME church in the nation to have one, because the preponderance of the population is African American, and in this health care bill, we not only address specifically some women health issues, but we also address issues having to do with racial disparity in the way that we've addressed their health care challenges. Today, we're talking with those that are in the community or associated with the community with disability. I had, prior to 1 August, over the previous year and a half, literally 8 town halls having to do with health. The first one I had brought up Young's Representative Kennedy, who on the House side was the leader, as Ted Kennedy was on the Senate side of the bill having to do with mental health parity. He came up, and at Elwyn, in my district, we had a town hall, a summit on mental health parity. My district manager, Bill Walsh, a Navy captain retired, who I went into the military with in 1970, and he went to Bonner, I went to O'Hara, I forgive him that every day, came out here just a few weeks ago to talk to those who were disabled in the veterans community. I ensured that when I went to Congress that my business cards had Braille on them, the first congressman with Braille on them, because I honestly have believed that if we are able to get the right type of assistance for those that are disabled, we are a more productive society. Not only in the value of our ideals, but the value and the productivity of our economy. With that, I'm going to stop and I'm going to leave it here for questions with one quick story. That microphone that everybody jumped at, it just reminded me of when, if you don't mind just a sailor story, of when I was in the Navy, early 70s, every ship had a call sign. I can't remember ours, it was something like Jupiter. And there was being Neptune. And there was this one speaker on the bridge that was never, ever a voice came out of. It was for a national emergency. And these were the Soviet Union days. So in a sense, if you were all of a sudden going to have a national war with them, that a voice would come over warning you of it. And for those who have been in the service, and I know there's some out there, but particularly those who have been in the best service, the Navy, not that I'm prejudiced, if you stood them if you stood those bridge watches at 2 a.m. in the morning and you're all by yourself, sometimes your mind drifts. And I can remember one night, we're sitting there, dark silence, and all of a sudden, over the speakerphone, which had never in my 2 years thus far on that ship had come, this loud voice like that came out saying, "This is Jehovah." Jehovah was the call sign of the admiral who was ashore. And let me tell you, everybody jumped like that because we thought it was the real Jehovah. So with that, I'd love to take questions, and however we're going to do this, let's proceed. Do I just point it out? She, when they first went like this, had the very first hand up, then I'll come back here. Go ahead. Right here? Right there.
Oh my God. You know, and I'll try to say slowly so I can be understood. You know, Hitler wanted to kill all the disabled. He had a plan called T4 to put them in a place called Harama Sanitarium, and they said, your life worth not living. My question, why is it better than disabled? If you have an attendant, like community choice, you're able to get up, get dressed, get washed, eat, go to work, pay taxes, have a life. Now I have a life. I have life. I don't know what it is with the working thing. Because when you're in a nursing home, or as I call them, death camps, and I'm a survivor of what I know, the death camp. You're laying there in your own muck with stage 5 bed sores, you're infected with maggots, waiting to die.
Okay.
But with community choice, it literally saved my life. Why don't you put community choice in your healthcare so people like me can have a life?
I think I got the whole. Did everybody get that? Would you make sure I've got the whole question right there, sir? We're talking about in the Community Choice Act about the challenges of nursing homes versus how they have been to how they can be, or you could live at home with assisted living or in community centers, which, correct? Okay, the own homes. But the Community Act does have in it included community centers. But it does have residential if that's what you choose. So it's a choice for you. So, got it. What this bill does is it does not have the Community Choice Act all within it. But what it does have in it is the first step towards it, as you probably all know, called the Class Act. Are you familiar with it? I'm not trying to argue the benefits of the two and that the Community Choice Act is the best way, which is why I've been a co-sponsor of it and a leader of trying to get it included the last 2.5 years. You are right. If you want me to stop there and say you're right, I can, or I can explain at least to those that may be unaware of how the Class Act has at least taken a small step.
You can explain the small step, but I just want to familiarize that most people here are on Medicaid. So
right.
The Class Act, unless they get a job,
that is correct. But then let me leave it to say, I totally agree. The Community Choice Act needs, it's why I'm a co-sponsor of it, and there are some things that have gotten in this bill and others that haven't that we need to go and get done in the second part, phase 2, if I might. For example, in phase 2, we also want to get what's called accountable, which has some impact upon it, but not accountable care organizations, ACOs. You're familiar with those? In order to truly bend the cost curve that is growing on healthcare, we are going to have to change how our medical system, whether it's Medicare, whether it's private insurance or what, rewards doctors on fee for service. How many times you come in is what they get rewarded on. But what we're trying to change to is where you have a large entryway of general physicians, hundreds of them in a network, where they're given a large population, and that they are rewarded not on how many times they see them. They are incentivized that if they're statistically healthy at that end of that year, their remuneration, their reimbursement is significantly higher. You want to change the incentive. Right, so what we did in this is said, which impacts this community, is we cap at $5,000 maximum anything anybody will ever pay out of pocket per year. We also say there is no limit on lifetime or annual or any type of expenses on care.
Thank you. Spitfire, remember the rule. One question per person. We have a couple hundred people here. We have a gentleman in the back, Congressman right here. I'm sorry to interrupt. Zach Lewis, who's been waiting to ask a question.
And the last, if I just might, and there are 0 co-pays for whenever you come in for preventive. Go ahead.
How you doing?
I'm doing great.
I work for Liberty Resources, and I'm under the Act 150 program. I just want to make you aware that it's a state-funded program, if you didn't already know, that allows me to have a job and get services through Act 150. Now, I'm just, at this time, the state is frozen right now. And I understand in the next 4 years or so, it might be completely wiped out. If this happens, then my services are in jeopardy and I might be at risk of going into a nursing home or become ill. And I'm just trying to figure out what are you going to do, or how can you ensure to us that this program continues?
The problem with what he's saying is that statistically, the percentage of those who are disabled and have employment has remained steadfast with no change, 0 nationally in the last 15 years, 60%. There has been no improvement despite many great efforts to try to have it. Ed Rendell has a budget problem right now. I just wrote him a letter yesterday where LIHEAP, the kind of fuel assistance for the lower income, despite in the government having provided $4.5 billion, the state is giving out money as though we only gave them $1.5 billion. I wrote him a letter just 3 weeks earlier on veterans, to where the assistance for them has been cut. And I'm happy to sit down and weigh in with him, but on the government side, our side, we have a lot more to do in this area. For example, I am the sponsor of the bill which got through the House, that the priority will be given in small businesses. If you are a disabled vet, you will get priority, sole source, if you can show you can do the job over any other small business. IDEA, I am co-sponsor of the act, even though it doesn't directly get to your issue here, where we have traditionally, despite the law since 1975 saying we should be training people under IDEA in special, those who are more challenged as they grow up, whether you're autistic or otherwise challenged mentally in your development or physically, that we've only paid 17% of our 40% legislative requirement. In the emergency supplemental bill, we increased that to 26%, but now what we have to do is that I'm co-sponsor of the bill that gets it to the full 40% by 2022. I'm happy to take your specifics here and weigh in. Ed Rendell actually called me after I sent the first letter and said, we're going to work on this. On this second one on LIHEAP, I was focused more that the winter's coming up, and I'm worried about the lower income, where they're not preparing to give them the funding, and I'm happy to work with you on this, both writing a letter to Ed Rendell and taking it back for if there's something where our assistance in the federal government has been shortchanged, which I don't think it has dropped one bit, because we would have been all over it. I'm happy to see what's happened at the state that we can assist. Is that fair?
Quick comment on this point. the congressman is from Delaware County, and we know that one of the leading Senate Republicans in the state legislature, Senator Pelleggi from Delaware County, who has not been cooperating in the budgetary process in Pennsylvania. So we hope that folks in Delaware County pay specific attention and call Senator Pelleggi's office on that. Let's take another question out in the audience.
Yes, sir.
Yeah, Congressman, my name is Henry Nicholas, and I'm the president of the National Hospital Workers Union, and I am
I've got your card.
I am 100% committed to single payer. It's less complicated and easier to understand, and it will get us where we have to go. My question is,
Single payer, got it, go ahead.
Single payer. Where are our leadership in defining the issue that all of us are hearing being debated all over the country? At the end of this recess, if the Democrats get together and decide where they are going, then we can find our way. The problem is there's a lot of discussion going on. Most people don't understand what's being discussed. And the Democratic Party have to play the leadership role in shaping debate, and I hope when this recess is over, they will get together, come out, running with the ball so we can get to the finish line. I negotiate for healthcare workers. And the issue that if I like what I got, I can keep it. I love what I got, but I can't afford it. When the contract expires, I need 42% of gross payroll to pay for my coverage. I can't afford that.
Got it. He's spot on. My concern is that when I head back to Washington, D.C., is that the Democratic caucus, is that the Democratic leaders have somehow weak knees. If there's ever a time for leadership, if there's ever a time for accountable leadership, and don't worry about your job, politicians, it's about what's right for the principle of America. It's this issue. And some of you know I got into politics after 31 years in the military because when my 4-year-old was struck with the same brain tumor that Ed Kennedy has, glioblastoma. She's 4 years. I just got off the phone with her just before I came in this room. She's here today because this nation gave the military TRICARE. And I was able, right here at CHOP, to have a pathologist diagnose it correctly, and then at Children's and Walter Reed, and to have her have a chance for life for brain operations, chemotherapy, radiation. Every American deserves what I had to save my daughter, and it's the sole reason I got into politics. And if there's ever a time for leadership, if there's ever a time for the Senate Majority Leader to stand up and lead us in the Senate, and with the President there beside him with his wonderful mastery of this issue to ensure that particularly the public health care plan option is an absolute requirement in order for us to have our pocketbooks not keep opening up to pay more and more and more. This is the moment. And you should all be doing what you did, sir, is telling the Democratic leadership, this is the moment. Don't dare buckle.
My daughter was diagnosed 26 years ago.
I know the case.
All I have done since then is fight with insurance companies. Not in our formulary, not in our district. There's always something wrong. Experimental medicine, there's always some kind of a tail to it. But all I have done since then, I am 70 years old. I thank Liberty Resources from the bottom of my heart. My daughter was paralyzed 8 years ago by Independence Blue Cross, who refused her to go to the one doctor who had successfully treated her. She's paralyzed and she's blind, and Liberty Resources has helped us. But my question deals with something slightly off that. My daughter is 28. I'm 70 years old. I ain't gonna live forever. She's been in a program called Freedom Valley, tying that in with a college education that I'm paying for cash because there's no help for her. Freedom Valley prepares her for independent living. We're actually looking for an apartment for her 5 or 6 years in advance. Well, they had just had their money cut and they're going out of business. And I don't know where we're going to turn.
We, in this bill, a significant part of it is that no pre-existing condition can ever be denied again in any health care plan. So my daughter, at 18, brain cancer, cannot be denied once I can't cover her anymore into being able to have her choice of which health care plan she wants. Second, there is a minimum level of benefits to stop the rationing that goes on today that says everyone will have these benefits, from mental health parity, which is in the bill, again, to the number of that there are 0 copays for preventive screenings, doctor visits, hospitalizations. A woman will have mammogram exams, colon rectal exams, glaucoma exams, bone density exams, and the same for Medicare. 0 copays. There is also in this the absolute prohibition, that's what's called rescission, where an insurance company can, 10 years after you filled out the paperwork and now you're sick, acutely sick, they can say, sorry, you don't qualify, you filled this out wrong. How do I know this happens? My office is open 7 days a week. Call us tonight at 9 o'clock. You'll get an answer on the phone. Call us on a Sunday evening, 9 o'clock. Someone answers. Woman comes in, cervical cancer. Insurance company denied her the treatment of the type of chemo that that woman's doctor recommended. Look at my daughter. She got a different type of treatment. It was type 2. It wasn't even approved through type 3 yet. Luckily, I had TRICARE. A parent of another boy who came in, stunted growth, a young boy. The hormone treatment he was recommended was denied by the insurance company, and we, both cases, with many others, had to intervene. This, as you said, is a broken system. Now, how do we address it also? If you live in the Philadelphia media market, where 42% of all Pennsylvanians live, one company, one corporation has 70% of all private health care plans. Sounds pretty monopolistic, doesn't it? Do you think you can, if you are an individual, which are the most expensive markets when you go out as an individual, try to get and negotiate a fair price with that? So the issue is this. The public health care plan option. The public means public citizen, Joe Sestak, public citizen, Bill Walsh, can just go in and pick it, choose it. Not a mandate, a choice. It's actually subsidized by the copays and the premiums, the deductibles of those who join it, just like any other private health care plan, but it doesn't pay for advertising. It doesn't pay $20 million for CEO salary or $50 million severance pay. And it doesn't have to make exorbitant profits. And all of a sudden, we begin to get a market that's fair. As I end here and take the next question, the Department of Justice has said that of all the insurance markets in America, 92% are in what's called a heavy concentrated market. It means it's on the watch list to see if it's monopolistic. That's not fair competition. And that's how we're getting both by the right regulations and the proper competition to fairness in the system. Yes, ma'am.
Good afternoon. I would like to know what precaution could be put in place to guarantee people with disability that own their own homes.
Get all their what? Homes?
What precautions?
The precautions for those with
guaranteed.
Guaranteed that they get the proper benefits.
Yes.
Yes. Here's how the bill does this. It mandates, and it references what they are, certain minimum level of benefits. But what it also establishes, so you don't have to at 9 o'clock come into my office at night, and I'll still keep it open, is what it does is sets up a health care advisory board committee with doctors, with hospitals, but with 4 patient advocates on it. Over here, it sets up an ombudsman. And my amendment said this ombudsman, which got passed and accepted, must coordinate all complaints that you're being discriminated against. And by the way, there's sub-advisory boards having to do with ethnicity and race. And that we're able then to have complaints come here to say something's gone amiss, I signed up, these minimum level benefits, it's not right. And they have to coordinate with the patient advocates over here in the benefit boards to make sure that maybe we have to do the benefits differently, or also to say this is wrong, overturn it, go back and fix it, like we had to with those 2 instances that I said. So we have established certain minimum benefits, so you can't be denied care. And care with no limit on catastrophic limits are gone on every health care plan. But if there's a complaint, this is where we set this system up.
Let's take a question from the back. I know a lot of people in the back have had their hands up for a while.
Yes, sir. Way back there in the blue. Or... Yes, you. Yes, sir. I'm sorry. I think
how this bill would help people who are on Social Security keep their health care benefits if they go to work, because a lot of people stay on Social Security because they lose their health care benefits, their access cards if they go to work.
Thank you very much. What we do in this bill is raise, first of all, Medicaid to cover everyone up, not to 100% of poverty level, but 133%. Number 2, for those from 133% of poverty level to 400% of poverty level, as far as your income, what we do is have subsidies on a sliding scale to help cover the cost of your health plan that you choose. You don't have to be in the public plan, you can be in one of the other ones. Now what we do is it's 150%. We say the most you can pay out of your own pocket is equivalent to 1% of your income. By the time you get to 400% of your income, 400% of poverty level, we will subsidize, but no matter what, you do not pay out of your own income more than 12%. So that's the way and the 400% of poverty level is about $85,000 for a family of 4. And by mandating it's not more than 12%, then that's how we try to make it fair between society and individual. And when you lose your job, if you lose your job, it's mandated you have to be in a health care plan, and that's how we ensure that you are in there. Yes, yes, with a hand up? Yes, sir. Is that okay?
Yes.
We have, yes. Yeah.
My question is, will that healthcare plan include being able to, if you're disabled and in a wheelchair and you need repairs for that wheelchair, will it be illegal to deny wheelchair repairs because a person with a disability switched their insurance plans under their new plan?
If you switch your plan, what can it? No. It is a minimum standard of benefits. And so when you switch plans, every plan has to have the same benefit, minimum level. Now, someone may say, I want to provide, and please, I'm not trying to treat this lightly, but a red wheelchair, you get your choice of colors, you know what I mean? We're just mandating that you've got to have it, all right? Anything above that, you can have. So when you switch from one to the other, we are mandating a minimum level that must be there. And if you don't mind, if one of my guys can get your email, I'll send you that section out of the bill. Is that acceptable?
That's acceptable.
So here is the concern. When you lose your, right now, sometimes people become risk averse. I can remember when I first got into politics, I went to Upper Darby, section of Upper Darby, and I was in a small home, and I had just begun. And about 8 people showed up, and one was a young woman. She had left the job, she told me, that she had always wanted, been there 3 years. And they dropped health care. It was the job she wanted. She'd gone to college for. But with her, she had about a 2-year-old. And she said, I took this other job. It's not for my skills, but it provides health care for my child. We all suffer because she's had to understandably become risk averse. She's not being all she could be and helps us become more entrepreneurial so the nation benefits. So now if some company doesn't provide health care, and by the way, it's mandated they have to after a certain level, but if some small business folds or something and you leave it, it's mandated that you get a pick of the same level of benefits in any other plan out there, in this other market as an individual, all right?
Congressman, we have one question behind you here. It's Buddy Homiller.
The people who are not able to pay for health care.
Marshall, did you catch that?
He was asking me a question on how can I
know right about the people who cannot afford
the dues. How about the people who cannot afford to pay for health care, the coverage and the co-pays and the premiums and all that?
Thanks.
Okay, what we're going to do is we are going to ensure that Medicaid continues for the lower income. For those, and that usually goes to poverty level, but now we're going to cover it all the way up to 400% of poverty level, which is, and I just tend to use one statistic, about $85,000 income for a family of 4. So if you're single and you're making $20,000, $25,000, we're going to give you enough of a government subsidy so that you can afford to go in and purchase individual health care. And we're going to mandate that you don't pay more out of your pocket, beginning at no more than 1% of your income when you're very poor, until you get up to 400%, it's no more than 12%. So it'll be a sliding scale, but with enough assistance. And why? This isn't just because it helps the individual, which is very important, but we want them to have health care. Why? If you have health care today in a family of 4, you pay $1,100 more for your health care policy than you would if it were no uninsured. Because the uninsured, when they're sick, usually they don't go into an emergency room till they're acutely sick. When they go in there and get taken care of, the hospital doesn't eat it. They pass it to the insurance company as overhead. When the insurance company comes forward to negotiate prices, and the insurance company doesn't eat it, they pass it to you. We're paying for the uninsured. Anyway, the concept is, if you get them covered, we'll pay less. Because they'll come in for 0 copays to get a screening for diabetes. Catch it early. And then make sure they take the treatments. And eventually we pay less as society. We lose $100 billion a year of economic productivity because of the uninsured, according to the Institute of Medicine. What are we doing? And you're paying for it anyway. And they're less healthy, they cost us the economy. So it's the right thing to do, and it's economically sense. Yes, sir.
Kathy had her hand up.
Right here in the front.
Right here. And then there's a lady all the way in the back, I think. I can't see very well. You just had your hand up out there?
Hold on, Kathy's going to go.
Yeah, I know. I just wanted to say that we spotted her.
You keep spotting them for me, would you?
Why? I understand the class act, but why after 17 years the community choice act? Because we should have the choice whether I go into nursing home first and advocate. Plenty of people want to get out, and they should be able to have the choice whether they want to live in the community or whether they want to live in an institution. Why should we have to keep on continuing to fight for it? It should already did it.
It's a similar question to the other one, right?
Basically, you said, why are we continually forced into nursing homes?
That, as I said, it sounded like the same question as...
Yeah, she said, why after 15 years it's not in there?
Nursing homes are mandated, home care isn't, and some of us are kind of fighting right now that we're going to lose our services. Also, she goes into nursing homes as an advocate, and she has many friends who want to get out of the nursing home, and we're concerned there will be waiting lists.
Got it. I agree. We just waited for a rescoring of how much this would cost. If you remember 3 years ago, they said it would be $7.5 to $10 billion. The rescore came in at about 1 to 1.5 billion. And that's a big change that should help us move it down the road. And you're aware of that change should come in. So we're hoping with that to show it's the cost is not what it was claimed to be, is so much less, that the quality of life, and I honestly believe the cost overall can be less if we do this right, eventually. Who do you want to get next?
You have your hand back. You've had your hand up back there. You still have your hand up. Chris is right near you. I can't see you, so I'm not calling you by name, but... I think you're in a black shirt, long hair. She has her hand up right now, Vicki. Yeah, that's her. She just stood up.
Hi, I have two questions. I'm an attendant for a consumer option employer on the Ober waiver. She's right here. And I'm also an advocate. Many times when I advocate for her and they find out she has Medicaid, they say, oh, it would be better if she has Medicare. So my first question is there a way to become duly eligible and not have to surrender, say, a life insurance policy? And the second question is, as an attendant, I would like to ask you to ask your fellow politicians to please look at the state budget and help the attendants to help take care of their consumers with health care and vacation benefits. We have no health care benefits, we have no vacation pay, and how can we take care of someone if we can't take care of ourselves?
And you're a state employee. If we can get your email, there is a section of this health care bill that begins to streamline the due eligibility issue on this. I don't know if it pertains particularly to your case or not, but I will send you the section and put, either I'll get on the phone with you or Adam will, my guide, to explain what we've done thus far. I have a feeling what you want to have done has not been sufficiently done from what you desire, but I need to know your particular case.
Yes, Congressman, this point's very important. Of all the consumers who receive services that are Medicaid funded through Liberty Resources, about 70% of them receive their services in the consumer model where they get to hire and interview their home care workers. When people come into someone's home, it's a very intimate thing. They want to make sure who they're hiring, that they're comfortable with them, and that they can terminate them. The big issue is reliability and retainability. These workers classically, over the past couple decades, are underpaid and have little or no health care benefits.
That's the second part of the question. I'm talking about the first half. Yeah, the second part of the question, I agree with. I am co-sponsor, and I did it in the we looked in this the first 6 months I was a congressman. Underpaid is an understatement. And I'm happy to send it to you, we don't have it in there specifically. But it is in a more generic way. There is and I know exactly what you're talking about. I was surprised when I got down there and we looked into this issue and the bill was out there and I immediately signed up afterwards about how underpaid you are. Because if we're not paying well, we're not going to get the quality that we want for someone that you want to feel comfortable with in your home and all. So what the bill does is set up it's called a health force advisory board or committee, okay? And what it does is it's not exclusive to nurses or doctors or general practitioners. It's for the whole area where this will be one of the issues to be assessed. You know, we're also going to have in there about nurses, physician's assistants doing some things that doctors, for example, in Pennsylvania, only doctors can do. Can we have physician assistants? We also have, on this one also, a sub-board looking at trying to have a more diverse healthcare workforce because we want to ensure that we take advantage of the talents of everyone, irregardless of race, ethnicity, etc.
I think we have a question way in the back there. Somebody who's been waiting for a while. We have one of our mic runners.
If you give me your email or one of my guys, we will send you that section of the board so you know that what I'm talking about and you can watch it. And in a second, as I appreciate the work you do. To let you know, there's also another bill that passed the House on July 27th where we want to reimburse better for our vets who have come home that you are finding. After I went to Bethesda and Walter Reed, I found, these are many mothers or spouses who are leaving their jobs to take care of theirs at home, and somehow we've got to reimburse them or take care of them. It's not directly to you, but it's the same home caregivers. Go ahead, please.
In the back.
Yes, I'm hoping that I'm not repeating the question 3 or 4 other people had, but I just wanted to see that I got this straight. I have cross disabilities, and I'm visually impaired and blind, legally blind. And I want to go back to school, and I also have a chronic illness that is a catastrophic illness. And I want to be sure that when I go back to school and become a really great, productive, tax-paying person, that I'll be able to continue having my hemodialysis paid for.
Yeah, I want to make sure there is something, you're talking about how some people, when they go to school after a period of time, they aren't counted, or is this because I can't see where you are? Where are you? There are some students who have lost their health care because they were dependent. Is that what you're talking about?
No, I'm not dependent on someone else. I'm a full adult. But I want to go back to school, and I have a catastrophic illness, which may or may not continue. And
I got it. Okay.
After I want to work, and after I get a job, I don't want to be forced in a situation where I have to say, well, do I continue with hemodialysis or do I work?
All right, I'm hoping I've got your question. If you have a catastrophic illness, when this bill goes into effect, no matter what you elect to do, you will have health insurance with no limits, no caps on taking care of that catastrophic illness, annually or for a lifetime. If you lose a job and have to go to another one, they must take you under the same requirements. If you go to school, the same issue. Am I answering your question?
Yes.
And this is why this is very important. A lot of people have said that the real cost of health care, the majority of it is for the last X amount of months or anything. They're wrong. The real cost of it, about 75%, is for those with chronic conditions, serious chronic conditions and all. And I've forgotten the exact statistic, but I think it's like approximately half don't have health care. But if you're able to get their care managed, we pay less. And that's why this is a critical piece of healthcare reform. Is that okay? I hope I answered. Question. Is this okay to take this one?
Yes, yes. After Dorothy, we're going to go with Oscar.
I can stay a little longer if I haven't bored you.
Good evening.
The only thing I got to do is I'm speaking at a lot of vets who've come back from Iraq. They're graduating tonight. It's over at University of Penn. It's a special course. Some of them have had, they've all had challenges in life, to be quite frank with you. And this is a course that gets them started down the road, and I'm going to speak at it. So I have bored you.
Good evening. I would like to know, how will people over 65 affected by this?
I'm going to repeat the question like she asked. How will people over 65 be affected? You are going to benefit from this. First off, let's just say you're in Medicare. Here's what's going to happen to you. You know that infamous donut hole of Medicare D that some of you fall into, that after you pay for $3,000, the government pays $3,000 of prescription drugs, then out of your own pocket, even if you have a private health care plan paying for drugs, you've got to pay the next $3,000 until the government picks it up again. We close that. It's gone. Number two, no more copays for preventive care. And your co-pays for mental health are the same as physical health. And the number of times you can go in for mental health visits equal to the amount of times you can go in for any physical illness. So you actually benefit. I want to make sure everyone understands, though, when I say this happens, and I should have made this clear, this plan goes into effect because of the enormity of the change. And I'm talking about the House bill, 2013. That's a disappointment to some. There's a schedule I could send you that shows what's going to be done in 2011, part of it, 2012, 2013. And then there's still a period of transition for over the years to get it completely done. You can't do anything just like this. But I want you to know that's what we're doing. So we close the donut hole over a period of years. I'm sorry it's not immediate, but it's the right way to do it, because otherwise we're going to mess it up if we just do it overnight.
Thank you. Let's go to Oscar.
Good afternoon. My name is Oscar Vargas. I'm a self-advocate. I was at, when you were speaking at the downtown. The question that I want to ask you is, how can we prevent cuts across Pennsylvania without people losing service?
The House bill that we passed over to the Senate had $100 billion cut out of it, of which $1.6 billion would have gone specifically to help Pennsylvania balance its budget. The Senate took it out. Number two, I was a proponent of a slightly larger impact bill because we knew at the time that the state's budgets would be approximately $300 billion in arrears, in shortfall. There were those who felt we could not do more because of outcries in public. But look what's happened. That logjam in Harrisburg has just begun to let, for example, if you read the paper, the $1 billion in weatherization funding for the poor to get their homes weatherized, which is not just good for them, but it puts construction and contractors and electricians, weatherization, the energy back to work. The education funding that we provided was stuck in there. So a lot of this was, we had wanted the money to bypass the governorships. And not this governor, but I'm talking overall. This agreement was about half of it would go through the state and half of it would go to like the Delaware Valley Regional Planning Conference, which does transportation. I would have preferred we had bypassed, because what's happened in Harrisburg has harmed, in my opinion, has harmed working families, those less fortunate. So I wish we had done more, but the House bill, well, it wasn't a perfect bill. I'd give it an A-, B+. We ended up with a C- bill because of what they cut out in the Senate. And that's where we are today.
Congressman, we have a question right here in the back from Sean.
I know what you're talking. That's why I'm writing these letters, and I wish we could do more. And I know Ed Rendell wants to work on this. And
yes. Hi, how are you? Thanks for coming again. What are you going to do? What are you going to do to rebalance people in the nursing home to get out and others prevent them from going in the economy?
Very similar question to the two that we had here, correct? We have to get the Community Choice Act passed. What time is it? It only takes 20 minutes to get there. I'll be okay. Let me know when it's 20 up. 6:30 and 20 up. I can stay. If you don't mind if I stay a little longer, do you? I think we can get there. Did she call to see if we could be a little late? I asked Molly to call. Just ask her, all right? 5 to be. Here's what I'm going to do, and I probably have owed this to you before. I will get back, if it's acceptable, to Tom, and just to see, I mean, we have enough people have co-sponsored it that is there, particularly since the cost is about 1.5 billion, to still have this potentially become a part of it. You're right, the Class Act doesn't take care of what you're speaking about. And when I go back, I'll see where we are on it. I'm aware it wasn't. I cannot promise, I'm going to tell you that. There's a lot of people down there, but I owe you the latest update, and I will have it to him the day after I get down. I might even find out.
Yeah, we need to all very vigilantly encourage Congressman Sestak and other members of Congress that the Community Choice Act will actually save taxpayer dollars, and the savings can be used for the expansion of health care. We have a question way in the back. I believe Bill Christner from the Pittsburgh area.
Not anymore. I'm Bill Christner from Philadelphia. I'm Executive Director of Disabled in Action in Pennsylvania. It's a consumer membership organization of people with disabilities, and I just want to follow up on what Sean asked. I'm not willing to give up on the fact that just because the House versions of the healthcare reform package don't include the Community Choice Act or its provisions to end the institutional bias, I still think that the President and the leadership and the conferees can make changes to that reform.
Without a question.
And I want to know if you're willing to go back to Washington and fight for us and push the leadership to include the provisions of the Community Choice Act that will in fact change the entitlement to nursing facility services to an entitlement to long-term care services and give people a choice.
Great. Absolutely. And I'll get back to you on, he's absolutely right. I wish I could guarantee you, but I learned a long time ago when I told my sailors we'd go overseas for 6 months and be back, and sometimes we'd come back 8 months later. All I could tell them to do is, I'm going to aim and work my hardest for it. And I wish I could, I'd like to give you a promise that it'll be in, but I can't. But I can promise you to work hard at it. It's the only reason I got into was healthcare, and it wasn't just for glioblastoma and pediatric cancer, it was for the whole field, and this is an important part of it. Yes, ma'am.
So just as a follow-up, will you go back to DC and push leadership to include the provisions of the Community Choice Act?
Absolutely, why not? I mean, I'm pushing them on TV every day. You just heard me here saying, Senator Reid, we need you to stand up and work on the public health care plan option. I mean, look, I'm running against the establishment anyway. You know that, right? So. I mean, trust me, I've got about 10 things that I'm going back trying to still get in, and I'm still trying to hold on to make sure the public health care plan option is in there. I mean, I have to tell you, that is such a priority that if we, as I said, as a gentleman here said, we don't get that in, our costs are going to just continue to soar. For example, autism. I moved the first money in 12 years increase in autism 2 years ago. This year it was 29 million. This year it was 50 million. I wish I could do more in this bill to try to have autism, whether it's ABA treatment or whatever it is, addressed. And that's another one I'm still trying to put in there. So what I want you to know is, I tell you, I agree with all of this. We're going to have to find the offset, do it under pay-as-you-go government, because you have to go with what the Congressional Budget Office scores it at. That's the rules. And for whether my autism, you know, getting it in, I got it in the defense bill, actually. I found 2 programs that didn't work, canceled them, got them canceled. The whole House Armed Services Committee voted against it. All of them, Democrat and Republican. I had to take it to the floor of the House to win. And that was just for autism, the first movement of money in 29 years. So I don't want you to say that just because I say I can get it done. It takes, every issue takes a lot of time and effort. And it's frankly why we work 7 days a week. And this is important to you, it's important to me. It's important because this is good for America to do, quite frankly. It's the right thing to do. So the answer is yes, but I can't guarantee success on every issue. But damn it, darn it, I'm going to try.
Congressman, we have a question right here from Michelle McCann.
Next over here.
Okay. My question is, in our insurances, when we need something like tilt or recline, we have to fight with the medical insurances to pay for it. And we're having a lot of trouble.
Whenever you have a what? A change?
A change, like if many of us use a tilt.
Yeah, got it.
And other types of equipment, but we have to prove that we need it. And I almost had to prove that I had a sore on me to get it.
I know exactly what she's talking about. I actually went out to one of the places that makes wheelchairs 2 years ago to be walked through the whole, it's in my district, to go through the whole differences.
There's a second part.
And so what are we going to do about that?
Yeah.
Got it. What we've done, again, is establish minimum benefits. The ombudsman, with this health benefits committee are going to be the one that makes this a living process. It isn't meant to be static. It's meant that people, that's why you have hospital representation, doctor representation, and patient representation. And another amendment I put in said we wanted the patient to be someone that comes, like Tom or the gentleman back there, that represents an advocacy group. It may be a rotating one or whatever, but what we want is for them to be at the table to help establish, as time continues, that if the minimum benefits aren't enough, they just say a wheelchair, no, you have to say for this, it needs to be this type. That is going to be an ongoing process. But the minimum establishments are basically exactly what congressmen and women get today. We took the federal employment health care plan that federal employees get to choose from, those 20 plans, and said that is the minimum level of benefits. So it's a pretty decent standard. From that, and by the way, I'm not in it, I stayed with my military because, I don't know, I'm happy.
I think we have a question.
But that is going to be the level from which we work on into the future. So it's a good basis because it's the one the Congress members get a choice of.
Fatty, do you have a question?
I promised her one.
Okay. Right there.
My question is, I know
hold the mic close to your mouth. Thank you.
I know we focused a lot on physical disabilities. They're very obvious, but a lot of chronic health conditions, which may not be so obvious, can eventually lead to very serious disability, whether it's diabetes that can make people go blind, or mental health, or amputations from diabetes. But it seems to me that some of the reasons people decline in their ability to function is because insurance companies and drug companies don't pay for this, things like test strips or medications that could help people become very high-functioning individuals who just happen to have a chronic illness, as opposed to becoming severely disabled individuals because they can't afford their medications or their insurance company won't cover enough test strips or something like that. Whereas if you cover it early, you can prevent the decline in functioning from something like diabetes or mental illness or epilepsy because people can take their medications as often as they need or get enough test strips.
Yeah, that is the two-pronged approach we have, is preventive screenings are free. They come in and get them. So we do first catch it. Stage 2, and then they're required to treat the disease. When you find it, it's a requirement in the minimum benefits to treat the disease. Number 2, though, is, and this is where we have 2 large pilot programs called, as I was answering the first question, called ACOs, Accountable Care Organizations, where we have about general practitioners are given a set from this patient load, and if they are healthier at the end of the year, that's how they are rewarded. not how many times you come in because you just happen to give them an exam. It's how healthy they are statistically at the end of the year, and that's step 2.
Spitfire, we have another question from Sonia, who hasn't asked a question yet. Sonia?
I have 40 minutes. We can make it in 20, can't we?
Hi, thank you for coming today. My name is Sonia Pasconi, and I have an autistic kid, and I did read the bill, and what I'm worried about is right now he's going horseback riding, and I have to get grants for that. It's an alternative way of therapy for him, and he's doing really well, but a lot of the grants won't pay at certain times when he needs it, and I only get like $400, and the state won't pick up for medical for him to do all this, and I want to know, is this going to be in...
Child, is that correct, is autistic, and part of his therapy is horse riding. Yeah, and by the way, this is a very legitimate therapy. I know that just from my own daughter. After her first brain operation, she was kind of quiet, 4 years old. 2 weeks after it, my neighbor said, come out, I've got a horse. She went on it, first time she laughed. And we sought out a farm up here because affinity. So what she's talking about is understandable. You're right. The problem with autism practice is today, and this is where I'm now focused, is even other types of treatments like applied behavioral analysis, ABA, they take a long time to get accepted as the proper therapy. The parent knows it, but statistically and medically, the government, before it does things at least, or insurance companies want these to be statistically analyzed and proven as treatments. So often what happens is to get treatments for these types, you have to get a grant. There is nothing specifically in this bill except one thing on this, to where we put, and this president was very wise because he actually put it in the economic stimulus bill also, money towards what's called comparative research. There's $2 billion in the economic stimulus bill. We have not quite that amount. I think it's $1.5 billion in this bill, to where we can begin to apply research to assess these treatments better, to find out what's working and what's not. There's nothing for horse therapy.
I'm not just only saying horseback riding, but I'm saying like any alternative therapy.
There is, what it is I've addressed another group on this, is it's going to be getting your therapy in front of the comparative research assessment. Because, look, when you have a child and other people had cancer, you look at anything. And we did. Herbs, we look at, we went with a doctor, but we want to know if there was something else that would interfere with it that might work. The issue here is, before the government gives money towards this, which I know may not sit comfortably with you when I say it, is there is a lot of ones that are out there that are good. There's some others that, quite frankly, aren't. They have to do the analysis before we apply limited national treasure towards it. But that's what this great president is doing, comparative research, and trying to get the monies out there to objectively assess treatments, both traditional and, as we move forward, non-traditional. I'm sorry that's where we are today, but...
Congressman, we're going to, it's approaching 6:30. We have one last question up front or right behind you from Philomena.
In 2006, I received a new chair. And this new chair had many issues. Let's face it, it was a lemon.
What was a lemon?
The wheelchair.
The wheelchair. It was a lemon, like a car, a lemon. Yeah.
My insurance company approved for me to get a new wheelchair.
They wouldn't.
They did approve it, but it took so long to navigate through the system for me to finally get a new chair. It just took a long time for me to get a new chair. I finally got a new chair, but it took about 3 years.
It took 3 years
To get a new wheelchair. Fighting with the insurance company the whole time, right?
Right.
Okay.
Well, the insurance company did approve it, but just going through the system of rehab places.
Just the whole process.
The entire process took a long time. And the new, with the wheelchair, and the healthcare reform act.
How does
when the new healthcare reform, will provisions for durable medical health, durable medical equipment?
Will we be able to address this problem?
Yes.
Yeah.
Is very important to my independence. It's a really important issue to myself and many other of my brothers and sisters.
Thank you, Philomena. I'll answer this question, then I'd like to say something at the end of this. All right, Tom. Yes, the process to address this is first this minimum level of benefits. Then that if you are not content, you have two choices. Bring it up to this ombudsman that is mandated to coordinate with the patient's advocates, because I wanted that done, to where the patient advocates will be there fighting and helping the ombudsman see the patient side of the issue. And number two, you can leave that insurance company and not be denied coverage, exactly what you have, to another insurance company. That's the change. You're held hostage. She changes that insurance. They have you. What choice do you have? So you fight, and you fight, and you fight, or you call the congressional office to have them try. That has to change. And so the whole issue here is, look, as an individual, if you're not in a large company, which we mandate you keep your health care benefit plans, and oh, by the way, these are the minimum benefits you must meet. But you're out there as an individual, let's say, or a small business, that you get a choice. It's an insurance exchange. Every company can put the plan in, and many will. Why? They want those 40 million uninsured. And they want all those other individuals who might walk away from their company. But mind you, every plan has to have this minimum set of benefits. Every plan has to have no more than $5,000 you can pay per year out of your pocket. Unlimited catastrophic care or acute illness care. Take every pre-existing condition, it's mandated. And then there's this public health care plan option here to keep everybody honest. Mandated? No. A choice. Oh, by the way, it doesn't have the overhead that these have, so the premiums seem to cost less. And that's where the competition to be, because she can walk out of that plan a month after she has the problem over to another plan and say, I'm not being treated right, I want to be in your plan. Now, mind you, the public health care plan option is going to be subsidized if she chooses it, with her premiums, co-pays, and everything else, just like a private plan. It's going to be run not by some CEO with $23 million salary. It's going to be someone like this. We hire someone for $250,000 to run the United States, to be president of the United States, a good public servant. We're going to find a good public servant. 5 minutes. Thank you. To do the same, to run it. And that's how we intend to address this. Look, as I wrap, first of all, I want to thank you for the opportunity. I apologize again. I regret that evening. Broad Street Ministry to me is a very precious place. I went there one night because I heard about vets. I brought Barney Frank that night. I'd already gone there to eat dinner. There's many vets there that are unemployed and etc. And there's many disenfranchised. So I brought Barney Frank there one evening to talk about a just world. We had a 2-hour discussion just with the congregation on a Sunday evening. And when they invited me back to do a healthcare forum, I jumped at the opportunity and should have thought through the disenfranchised here. They don't have a lot of money, obviously, and all, but I came out and the first thing, I guess, what's going on, I didn't know. I came out to shake hands. You told me, I said, I'll come and meet with you separately. So thank you for that opportunity and your patience and understanding.
Congressman, before you leave tonight, we want to first give you a very warm round of applause and thank you for coming to Liberty Resources. And also, on behalf of Liberty Resources, Pennsylvania Adapt and Disabled in Action of Pennsylvania, we'd like to present you with a Community Choice Act t-shirt. Yay! Free our people! Yes! And Cassie James, our National Director of Policy and Advocacy, would like to present you with our annual report, which gives a great overview of our programs here at the center.
Thank you.
Thank you so much. Yeah, and Cassie has a couple comments.
I'd like to thank you very much, and I'll try to be brief, but one thing we need right now, we need a champion. We need a champion at the federal level, and we need a champion in Pennsylvania. We have been hearing different stories all week. We've been told the last couple of days that our waivers are even in trouble, that there's not enough money right now in 850 to serve the people that are on waivers. We're told that we have to make a waiting list for Act 150, which is the only program in Pennsylvania that people who are not Medicaid eligible and work can co-pay into and go to work. It's going to cost the state way more. It's going to cost them a mega money if they let go of that state program and impoverish people that are working now and paying their own bills. They just don't think ahead. And if they stop the rebalancing, not only are we going to pay the price and be lying in those beds, and we're real people and you see us now, and we are the people that end up in those places along with the elderly. That's going to cost too, and it's the wrong thing to do. But Pennsylvania right now is, I know people are standing up for us, and I know Governor Randall is standing up for us, believe it or not, even though he was forced to do that, partly so our programs could be paid. He had to sign 850 in order for the providers to be paid that serve us, and also for the state workers to get paid. But he has stood up for our programs. But they have to raise taxes or do something, and this is a commonwealth. And it's not about some, it's about all. And when that Medicaid goes to everybody in this country, if you leave out the Community Choice Act, there is a possibility that we will not have enough money to keep this rebalancing and this momentum going. So please, be a champion. Don't let them go back 20 years.
If I could, one last thing. The reason I'm a member of caucuses like the Autistic Caucus or other issues is, and why I gladly came here today, or I've co-sponsored everything from Community Choice Act to the Class Act, is the following, and it just so you know where I come from. There's this wonderful midrash for those of the Jewish faith that tells the story about when God came down from the, I'm going to be the first Catholic editor of midrashes, by the way, I want you to know. is when God came down from the mountain after receiving the 10 Commandments and had found that the Israelites were worshiping a false god, in anger, as you know, he threw down the 10 Commandments in anger and shattered them. He went back up and got a new set, and when he came down, as the Midrash says, he put them in the ark, the tabernacle, to continue the journey. But he also put inside the tabernacle the broken pieces of the first set. To me, what that symbolized is we all come down from above, equal in the eyes of the Almighty. We all tend to arrive here in different stages of needing repair. We all do, every one of us. The key here is, do we as one community, which is why the word community up there means a lot to me, do we all together, the whole who arrived here more fortunate potentially than those, but recognizing they're equal, do what we have to do to be one in the equality of the way that we go forward, whether it's in the Ark or it's in the United States of America. Thank you.